disease.
Thank you very much, and good afternoon, everyone. So the level of the problem in the Afro region is that sickle cell disease is the most prevalent genetic disease in the Afro region, with about 10 to 40% of the population in the Afro region carrying the trait, and resulting in an estimated prevalence of at least 2% in the region. The situation in the region also indicates that current national policies are inadequate, with appropriate facilities and trained personnel being scarce, and adequate diagnostic tools and treatment being insufficient. In Nigeria, sickle cell disease is among the top 10 non-communicable diseases, causing significant disability, morbidity, and mortality, and this one that has impacted negatively on Nigeria's ability to attain the Millennium Development Goals, specifically 1, 2, 3, 4, and 6, as well as being likely to significantly affect the attainment of the SDGs if we continue with our business as usual attitude. In terms of the burden, Nigeria has the highest burden of sickle cell disease in the whole world, ahead of India and Democratic Republic of Congo. Our 1990 National NCD survey reported about 25% of sickle cell traits in adult Nigerians. So Nigeria is ranking first as a sickle cell endemic country in Africa, with an annual infant rate of 100,000, representing 8% of the country's infant mortality. The WHO 2015 report estimated that 2% of newborns in Nigeria were affected by sickle cell anemia, giving a total of 150,000 children being born every year with sickle cell disease in Nigeria alone. The WHO also said that sickle cell anemia is one of the main causes of premature death among children under 5 years of age in Nigeria. For the first time, Nigeria was able to include sickle cell disease in its national demographic survey, and this was actually the first country in the world to do so. And from the results of the survey showed that deaths from sickle cell complications occur mostly in children affected under 5 years of age, adolescents and pregnant women, thereby affecting, this is actually, I'm not able to see, okay. So, yeah, I need to take that again because I wasn't seeing properly. Deaths from sickle cell disease complications occur mostly in children affected by sickle cell disease under 5 years of age. Adolescent and pregnant women are also involved, thereby driving the neonatal, infant, and maternal mortality indices in Nigeria, and denying these groups meaningful contribution to the socio-economic growth of the country. From the NGS of 2018, there was a prevalence of sickle cell disease among children aged 6 months to 59 years of 1%. And there were no substantial differences in the prevalence in relation to age, gender, or place of residence. According to that survey, the prevalence was highest in the Southwest at 2% and lowest in the South-South at 0.3%. Overall, the National Demographic Survey reported the prevalence of sickle cell traits being similar across background characteristics, with the prevalence being highest in the Southwest for HbAs and 5% for HbAc. So, coming to terms with the problem of sickle cell disease in Nigeria, the government took an affirmative action in 2011 to address the menace of sickle cell disease, as well as other non-communicable diseases, and participated fully in the 2011 UN General Assembly and took steps to implement the resolutions from the meeting. First, a national desk was created for sickle cell disease within the non-communicable control program of government, and several steps were taken to put in place policy and strategic plans, which included the production of guidelines for the management of the disease, as well as a protocol for newborn screening. Support groups were established along with the 6 zonal centers for sickle cell disease control and management, with community mobilization and commencement to ensure buy-in of the general population for the government interventions. The centers were mandated to engage in genetic counseling to screen newborns, infants, and adults, institute comprehensive care for those identified, and engage in sickle cell disease research. The support group has since transformed into the Sickle Cell Support Society of Nigeria. Steps were also initiated to expand the national immunization schedule to accommodate pneumococcal and influenza vaccination for children with sickle cell disease, and hydroxyurea was included in Nigeria's essential medicine list. The 2018 NGS survey was planned to include sickle cell disease and nutrition indicators for the country to inform priority government policy objectives and direction. A multi-sectoral action plan, and it's important that everybody knows that this plan is in place and was launched in Nigeria in 2011 and is accessible online. This multi-sectoral action plan 2019 to 2015 was launched to include SCD and other NCDs. And partnership measures were also put in place to engage stakeholders who are interested in working with government to address the menace of the disease. The measures of partnership with government for sickle cell disease, government reasoned that multilateral partnership approach should be adopted for sickle cell disease, considering the ramification of issues surrounding the disease in Nigeria. And such would include working with our country-level partners and stakeholders to produce policy and guidelines for the management and control of the disease, as well as include the minimal support from WHO country office, the MDG office of the presidency, the academia, and the indigenous pharmaceutical companies, as well as Pfizer Group. However, partners that are interested in sickle cell disease are just too few to make meaningful impact, but this has not deterred government from forging ahead with the national plan for the control of the disease. The good news is that the pattern is changing, although they may not be as rapid as would have been expected. So what could be responsible for the poor partnership support? There is a culture and belief of many groups in the country that actually makes people not to want to come out and identify themselves as having the disease. And there is also a lot of uncoordinated activities of NGOs within the sickle cell space. And the government has been saying that they have to address this. There has to be one umbrella organization that coordinates activities of sickle cell disease within the country. And that is why there will be one voice to talk and be able to work with. The government will identify people that they can work with. Development partners are also disinterested in sickle cell disease and are fatigued from funding other equally important public health interventions. Non-prioritization of sickle cell disease due to lack of understanding of the contribution and linkage of the disease to poverty and mortality indices of children and mothers in Nigeria by the major development partners. And so we need to be able to pitch to people that this is a maternal and child care problem. Poor integration of sickle cell disease prevention and control services with other health and non-health services, especially maternal and child health care services. So this needs to be integrated. And then lastly, on this page is inability of government to mobilize the much needed resources for sickle cell disease interventions. So what would be the next, what's next for meaningful and sustainable partnership for sickle cell disease in Nigeria? There's a need to scale up high-level advocacy. There's a need to scale up high-level advocacy and dialogue for sickle cell disease interventions, streamline and coordinate activities of NGOs and CSOs in the sickle cell disease space, integrate sickle cell disease control and prevention into other relevant intervention activities, encourage implementation science as related to sickle cell disease control and management through facilitation, support, and coordination of sickle cell disease research and utilization of research findings. And then find funding to implement the multi-sectoral action plan. Way forward, and I want to ask that on behalf of the desk officer, that people should pay attention to these as we discuss further. Thank you very much.